Good morning. Welcome and thank you for joining us today for the Compass HIN Using 211 to Address Client Needs webinar. I am Katie Fodenhauer, Education Manager for the Iowa Healthcare Collaborative. Before we get started today, I want to walk through a few brief housekeeping items. Attendees on this webinar are automatically muted. However, we highly encourage you to interact and ask questions during the event using the chat box function, which can be accessed by clicking the chat box at the bottom of your screen circled here. Before entering a question into the chat box, please be sure to select Send to Panelists and Attendees so all attendees can see the questions. We will have staff members monitoring this chat box at all times. Please ensure that you are using either your phone or computer audio, not both, as you will encounter an echo if you have both enabled. This event will be recorded and information will be shared in a follow-up email on how to access the recording and the slides. It is now my pleasure to introduce our speakers for today, Erin Drennan and Melissa McCoy. Erin is the Community Impact Officer of Health at United Way of Central Iowa. Her work focuses on advancing United Way's mission of improving lives by managing the development, implementation, and evaluation of a community impact agenda in the focus area of health. Guided by the Community Health Goal for 2020, Erin ensures that strategic direction and community action measurably moves forward, meeting the goal. Prior to joining United Way, she served as an executive officer at the Iowa Department of Health. Erin earned a bachelor's degree in social work from the University of Iowa and a master's degree in social work from the University of North Carolina, Chapel Hill. Melissa McCoy has served in key leadership roles with 211 for the past 13 years. She is currently the Director of 211 with United Way of Central Iowa. Prior to 211 transitioning under United Way, she was the 211 Program Manager at the American Red Cross in Central Iowa. As the current 211 Director, Melissa provides strategic planning for a comprehensive information and referral program serving more than 30,000 Central Iowans annually. In this role, she is responsible for the day-to-day operation of this critical 24/7 service. Melissa earned a bachelor's degree in political science pre-law from Grandview University. Welcome, Erin and Melissa.
Thank you, Katie, and thank you guys for the opportunity to allow us time out of your day to share with you the importance of Iowa 211 and what 211 does in the state. So I'd just like to start out with our next slide, please. Can we back up one slide, please? Okay, well, we'll just go from here. So 211 is a national helpline, and it was recognized in 2000 by the FCC for the exclusive purpose of providing widespread access to the health and human services world. We also are a connector to our community resources. As you guys might understand, is that sometimes it is hard to navigate through this whole web of community resources. And so that's the importance of what 211 can do for you. 211 is also used during times of disasters. We are free, we're confidential, 24/7, statewide, and we also have access to a language line. Our calls do differ day to day, such as volunteer income tax assistance program, landlord tenant assistance. I'd like to share that with us being a national helpline, that 94.6% of the US has been covered by a 211. 211s have been around for over 20 plus years. For the state of Iowa, we have a collaboration of 5 different partners within the state that ensures a 24/7, 365 coverage for those individuals in the state of Iowa. We've also been able to utilize the national partnership that we have during times of disaster. We can push updated information to communities throughout our site with 211. And so even in times of disaster for us here in the state of Iowa, we had the flash flooding event of last year, and we were able to rely upon our partners across the state to help us provide information so that it was a seamless program across the state. If we become overwhelmed, again, we're able to utilize those across the state, but we are also able to help those across the US. During the hurricane and tornado events across the US, we were able to help those affected by Irma, and we were able to push out information via text and phone calls by just assisting and logging in with those individuals. Next slide, please. In 2018, 211 answered 77,957 calls, and we provided 86,633 referrals to resources for those calls. So if you stop and think about that, as a state, 77,000, almost 78,000 calls were received, and with those calls, we were almost able to provide over 90,000 referrals to those individuals looking for something within our area. Next slide, please. Out of those 78,000 calls, we've noticed that usually over the last 10 years that I've been in this world, our top problems and needs continually stay the same. The only one that will fluctuate in and out of our top problem needs is going to be the disaster services. So if you look at this, we have the top problems needs across the state of Iowa is housing. I'm sure those of you in your areas are seeing that need also. Income support and assistance, that's where your rent and your mortgage and your utilities are going to fall in. Disaster services, the more we start flooding on the eastern and western sides of Iowa, they're reaching out to 211 to find assistance within their communities. Individual, family, and community support, that's a given. People are always looking for assistance, and that's why 211 is here. We're here to help them and provide them with that information on where to turn and where to look for assistance. Another one is going to be food and meals. So one thing that we've always noticed within the last 2 to 3 years has been that, meal sites have been utilized. People are looking for food and don't know where to turn. So when they call 211, we start problem solving with them. We're like, what, have you utilized a food pantry? Have you applied for SNAP benefit programs? We're walking through the process with them and helping them sometimes to think outside of a box. It can be so easy for some of us to say, have you been to a food pantry? But guess what, people? Food pantries can only serve certain individuals once every 30 days. Some of them in some of the rural communities only serve once every 90 days. Can you imagine trying to get by with your family on 1 month's worth of food for 90 days? So what 211 does with these individuals is that we walk them through and we problem solve, and we're helping them think outside the box by, are there meal sites? Is there something else I can do? Can I volunteer my time to do a share program? I'm sure you are seeing these same problem needs as we do day to day. Next slide, please. So here are just a few examples of information and referral that we can provide information for. I do want to detour you from just looking at this and saying that's all we do, because we encourage everybody to give us a call, and no matter what they think they're looking for, call us, because even if it's outside of some of these services, we're able to do much more than what's just listed here. For example, under addiction services, we're able to talk to them and provide information on substance abuse counseling, outpatient support groups, opioid addiction treatment programs. Under legal assistance, we're able to help those individuals when they're calling in not sure what to do about, they're having an argument with their landlord, or their landlord they feel is discriminating against them. We're able to walk those individuals through the process it takes and how to navigate the system. We are that connector for those community resources. Uptick we're going to see here usually within the trends for January and February is going to be your senior support services. A lot of individuals will go home for the holidays and visit aunts and uncles, or even parents. And what they find out is that they've talked to their parents over the year. They call, they check in, they see what's going on. But once they come and see on site what's happening in that parent or that family member's home, they're a little concerned, because sometimes, our parents or grandparents or family members just need a little help. And so that's where they're going to turn to calling 211 And we're going to help direct them to some supportive services, such as the Homemaker Assistance Program. They may need some additional food services that are delivered to the home. That's where we're able to guide them and walk them through those programs. Maybe even just, being lonely, needing somebody to turn to and talk to. That's where we're that connector for those community resources, because we can help those individuals navigate the system, find the senior centers, find some support services, even just talk to them. I mean, there's a peer support counseling line that we do. There's other ones out there like that, just checking in with those individuals. Another big uptick that we're seeing right now is the seasonal projects. So we help navigate the system and walk individuals through signing up for some holiday support. So that can range anywhere from looking for a food basket, looking for Toys for Tots programs, recreational activities for your children to do while they're out on the holidays. We're able to help navigate that system. Last month, we signed up 545 individuals for a Toys for Tots program, and that was just in 1 month, and we're one of many, many programs that do Toys for Tots across Iowa. Next slide, please. I'd like to share with you that there are 4 easy ways to access 211. As traditional means have been, is we can always pick up the phone and dial 211. You can dial 211 from your cell phone. You can dial 211 from your landline. One of the newest things that we have done is to add a texting service. You would text your zip code to 898-211, and you will get a live community support specialist on the other end that is able to provide you the same information that we would by picking up the phone and calling. The age group that I have found that absolutely loves the texting feature is the 60+ population. The reason why is because sometimes they have hearing issues. Sometimes they transpose numbers, and I'll just tell you, me as being, 40+ years old, I do transpose numbers myself. So I do tend to text once in a while myself. But then they also have the information on their cell phone. They can pull it up and look at it right there and know that a food pantry may be open 8 to 5. Here is the actual dates that it's at. People are also able to access the information that we have at 211iowa.org. The population that we've seen that find this really handy is going to be your school counselors, somebody that's working one-on-one with a client in their office. They're able to navigate the system right there from their desk. One of the newest and most, let's say, delightful things that I've had the passion of doing was helping create the 211 Iowa app. And with the 211 Iowa app, I am going to turn that over to Erin so she can explain the partnership and how this came to fruition. So here's Erin Drennan.
Great, next slide, please. So just to provide a little bit of background about the development of the app, and I'm sure a lot of you who are joining today certainly would have a lot of knowledge and background in how this app can be useful in the healthcare sector. And of course, it's a group that has been using 211 resources for quite some time, but the building of the app really started through some conversations that we were having with Unity Point Health Des Moines, and then we brought on several other partners. I think one thing, that's interesting to note when Melissa listed all of the top issues and needs that come into 211, none of the top issues were health, quote unquote health. But what all of you know on the phone and what we know really well is that they're all social determinants of health. And so those are all factors that greatly, greatly influence people's health and well-being, which then is influenced by how they show up in the clinics and hospitals and other services that many of you on the phone provide. So really, this conversation started out of really great timing, and I think interest from a lot of partners. So Iowa Healthcare Collaborative approached us as well, and we really all started having a conversation about this desire. We know that in the healthcare world, healthcare providers are very constrained by time and resources. And so a lot of the conversation was around how can healthcare providers, care coordinators, nurses, others who are, who have regular communication with patients, but of course aren't, able to follow them home and provide them those hands-on support and resources. How can we really help connect those folks to the resources they need within the time constraints we have? So the app was really built with a couple of audiences in mind. One was those care coordinators and others who can spend the time with patients, maybe those who have chronic conditions or other complex needs that, maybe you're already doing some navigating of the system for them and doing a lot of referrals for them anyway. So that ability to have it on your own personal cell phone that you can pull up and give them resources, but also having the individuals and the patients themselves be one of those audiences and users as well. So making sure that there's posters and brochures and other information up within those healthcare settings, and then really doing that simple education of patients about, here's a resource. We can, give you this specific referral today for whatever it is you're presenting with, but in the future, here's an app that you can use yourself and search for additional resources.
Thank you, Erin. And we'll go ahead and I'm gonna slip to the next slide, please. And so just to give you guys a background, here is what the actual app looks like. And I would love for all of you guys to take a moment here today at some point and go ahead and download the app and test it out and see what you think. So you're able to, with the 211 Iowa app, you're able to search by your own city, your zip code, or you can use your geographical location right then and there. The first page on your left is going to be your main page, which is going to be your categories. And what you'll see in the future is that we are moving our 211 website to have these same categories so that it is the same no matter where you go. If you're going to be on our website or you're going to be on the app, you're going to have the same icons and categories and you'll be able to search. Next page is going to be where you're going to break it down. So we go to food. From food, you can go to strictly food vouchers, free meals, to the farmers markets. And then on the next page is where it breaks it down even further, and you'll be able to click on the actual agency that provides that information. From there, on that last one on your far right, that is where you would be able to share with that individual. You can bookmark it to your favorites, which is a really cool and handy tool to have so that people don't have to continually look up the same information. The individual that uses this can call directly from that call button, or they can go straight to the website for the DMARC mobile food pantries. If they'd like to share it, that's going to give you the option to text it to an individual. You could email it to an individual, all right from that page. And we just launched this, and so for my numbers from July to September, I had over 1,200 users, and the highest population so far has been Waterloo, Des Moines, and Cedar Rapids, with almost 6,000 events. Our top search events have been rent, utilities, food pantry. The agencies that individuals have searched the most have been the DHS food stamps, Iowa Finance Authority, and then would be Salvation Army and St. Vincent de Paul, just to give you a little background on what people are looking for. This is mirroring what we see when we get calls or the website. Some people they always come back and say, well, aren't you concerned that your calls are gonna start dropping? And for us at 211, it's not about call volume, website hits, statistics, any of that. It's more about being sure that those in our community are able to access the assistance that they're looking for in the way that's most convenient for them. So ultimately, I can add all these numbers together and say that we are seeing an increase. We're seeing an increase in people searching for food. We may not be seeing it in calls, but people are still reaching out. And those might be the individuals that wouldn't have traditionally reached out to us by phone. When we created the 211 Iowa app, we've got a toolkit and a video on how to download it. And we're going to go ahead and play this download video for you for a moment, just to see the simplicity of how easy it is to use.
The 211 Iowa app is a new free resource to help you find the help you need. Use the app to connect with local programs for things like food, housing, financial assistance, employment services, healthcare, and much more. The app is easy to use and 100% confidential. You can download the 211 Iowa app on an iPhone or Android smartphone. To get started, search for 211 Iowa in your smartphone app store and download it for free. When you open the 211 Iowa app, select Use Current Location or enter your zip code or city. Then choose from various categories or search for a specific service or program. You will find a variety of local service providers and organizations that are ready to assist you. Tap on an organization to find out more and to view contact information. You can also seek assistance from a 211 Iowa Help Navigator by dialing 211 from your phone or visiting 211iowa.org. Download the 211 Iowa app to find help in a tap.
All right, and thank you for showing that. So I mentioned that there is access to a 211 toolkit, and so I'm going to go to the next slide, please. I do want to remind you guys that 211 is a 3-digit helpline. It is free. All these different ways to access us are free. It's confidential. It is statewide, and we are all trained professionals here to help those individuals that are seeking the assistance. So from here, we're going to go to 211iowa.org.
She's going to give you you are the host now, so no, we shouldn't be seeing your screen.
I'm going to go ahead and make Melissa the host now if you want to take control, Melissa, and drive it from your end.
All right, give me one moment here to pull up my website. All right, and can you see our website at this time?
Melissa, you'll want to hit share at the bottom of your screen. There should be a kind of a green button that says share.
How about now?
Yes, perfect.
All right, thank you. Okay, so this is our 211iowa.org website. And so from here, this is where you would access the information for 211. And I spoke of earlier is here are the icons that we were talking about. So after January, those icons will sync up with what we have for the app. But today we're going to focus on two main things here is the 211 Iowa app and the promotional toolkit that you're able to access. And please bear with me while my computer spins here. So from this page, you are able to get information on how to download the app. You can have access to the promotional videos. And then you can also, here are the printed materials that you could download yourself, or you guys can reach out to myself or Aaron, and we would love to be able to get these, or even through Iowa Healthcare Collaborative to get you this information. We do have some really cool window and mirror clings that you're able to access. And what we found with these they're pretty helpful to have in bathrooms on mirrors so that somebody's stopping and taking a look to see what it is. And it shows them that it's 3 different ways or 4 different ways now to access 211. We have some sample communication, so just some talking points. But then if you wanted to utilize our logos, we've got everything here that you would need. One of the newest things that we just created, which I know that Aaron has not seen yet, is we have a QR code that you're able to utilize. So if somebody took the picture of that, and we can put that on the materials, and then they're able to download it straight from there. So I'm pretty excited with that one. So the big thing that I would like to talk with you guys about also is going to be 211 counts. So for a lot of people in the community, you guys write grants, you're wanting to see what's going on in your communities. You want to see what's 211 doing and how we're helping, and if we've got unmet needs in specific communities. At the top of the 211 Iowa website, we have a spot, it's called 211 Counts. You would click there, and then we're going to go ahead and click over here to see what the needs are going on in Iowa. Everybody has access to this. It's free. What we've found is that a lot of people in the past would be calling in and saying, hey, what's going on in my community? Can you pull the report? Tell me, you know, so it was taking a lot of time to sit down and navigate through the systems and provide the information for individuals and what they were looking for. So we felt this would be very beneficial to have on the website and share with everybody. You can use this for stats when you're writing grants. You can use this site to see specific needs again in your community. It breaks it all the way down by your district. We can do congressional districts, we can do counties, and we can do specific zip codes. I won't go through everything for you here today, but I am going to show you the main points of if you'd like to do a specific county, we're going to go ahead and just do Polk County, Iowa. And you can always do more than one county or more than one zip code here. As I said, here's your congressional districts, your state house districts, and then your school districts even. That's been very helpful for individuals. So I'm going to go for the last 30 days. And after I hit Polk County, I'm going to hit search. And it's going to show you in percent what the calls have been that we have received at 211. I like to change it over to count just for my own personal satisfaction. One thing you will want to know is that this is strictly our calls. Right now we're looking at how to integrate our 211 app information and the website information onto here, because that's going to give you a bigger picture of what those needs are that are going on across the state and in those communities. So in the last 30 days, we had 383 calls of individuals from Polk County looking for housing and shelter. And if you hover above here, it tells you kind of what the definition of housing and shelter might be. We'll go over here to shelters. It shows temporary housing solutions. 131 of those 383 calls were for shelter. You're going to see that we have unmet needs over here. That's helpful for you guys to notice too. 8% of those unmet needs can range anywhere from the fact that they've already utilized the sheltering services and they've been out. Sometimes the shelters are only good for 30 days or 90 days. There's all sorts of different factors that go into making it an unmet need. Within some of the counties across Iowa, they collect the demographic information. And so if you click on the two little bodies there, it'll show you the gender and the age of those that are calling in that are looking for assistance. And it's broke down for those specific areas. So as you see, we had 74% were females that were calling in for the housing and shelter services in that 30-day time period for Polk County. Remember that we're not doing the whole state at this time. We'll come over here to, let's look at mental health and addictions. In the last 30 days, we've had 23 calls. 9 of those were for the mental health services, which is assessment, screening, testing, counseling, other therapies. So 9 of those calls were able to seek out assistance that otherwise might not have been able to find assistance. We're going to scroll down here a little bit, and you'll see that the top 10 highest rates of requests for mental health and addictions by county in the last 30 days, mind you, because I've changed it to 30, has been Poweshiek, Palo Alto, Cass, Lynn, Britton. And it's going to show you for that time period. Now, we all know what's going on in some of these communities. There's a lot of flooding going on. It's still happening in those communities. Those individuals might need somebody to talk to. So at least 211's here to help provide them with some of that information. You're able to see the trends in the last year compared to this year so far. And then when we scroll over here on top of Polk County, you're going to be able to look at what the percentage in poverty is for Polk County versus the state rate, and your employment state rate, and your high school diploma, and your rental housing for the state rate versus the Polk County. So this down here will always change based upon where it is that you're looking for those services. So I'm going to go back up here and I'm going to put in all again for 1 second. And we're going to reset so you can see what it looks like for that whole year from November 3rd to December 2nd in that time period as a state. You'll see that there was 880 calls. Or we can go over here and let's look at the mental health and addiction for the 62. And we're over here looking at the mental health services, those 30 calls. And now it's going to tell you again what area those calls were coming from. So we found this to be very helpful, and it's free and it's here for anybody. At any point you have questions about this, we're here to help and answer what we can about the 211 Counts site for you. At that time, this is what I have for 211 Counts. And I appreciate your guys' time today and look forward to working with you all in the future. If you have any further questions, Erin and I are both here and we can go ahead and field some questions for you.
Can I just jump in? This is Erin. Melissa, just because I saw on one of the questions, I think what it was getting at, so I'm just going to put you on the spot. So if you're in a community and you're a provider and you know you've gone onto the app or the website and you know that there's services or resources that are available in your community that aren't listed, what do folks do then?
Sure, and what you would need to do is you can reach out to myself at 211 or on the website. You'll see where it says contact us. Excuse me, sorry about that. Can you help give them their sharing rights back? We're here to help you get those resources into the database. We do have a inclusion and exclusion policy that we can vet, but there's always a way to try to help those individuals get that information into the database. And please bear with us while Erin and I are trying to ensure that you guys get the right information here.
They have the screen back.
All right, and Katie, you do have the screen back?
I do. Are there any more questions? Please feel free to pop them in the chat box if you have any more questions for Melissa or Erin.
And so, Barb, that was answering your question that Erin had brought up. So if you'd like to speak with me, my contact information is right here on this last slide. And I'd be more than willing to work with you to see what we do have and if there are things that you feel are missing. As you know, we aren't in a lot of these communities, so we do look to you all across the state to help us build this, because it is something that's very beneficial for you and your clients and those in your community. We want to be able to, have resources for them. And what we're finding out is that there are lots of, deserts. So somewhere might not have but one food pantry. That's the kind of things that we're working for and wanting to build the relationships with individuals like you guys that are in that community day in and day out.
And I would just add, the value of getting those resources put into 211 is that then, Melissa has talked about how, the folks who are working in 211 are information and referral specialists. So they're trained, and part of their practices and policy are that those are regularly reviewed and updated. So once those resources are in the 211 database, you are assured then that organization, that service, that program is regularly contacted to make sure that everything stays up to date in the database.
And as we know, as you've shared here, Barb, is that we've all in the past created spreadsheets, and if we don't have people or time to keep these updated, that's where things have fallen to the wayside. And it's a valuable resource. It's free. It's confidential to those individuals that are seeking it. And even for you guys, it's been very helpful. We've had lots of, I've done lots of presentations with the care coordinators, and the feedback that I've gotten from them, even just sharing with their clients and showing the client how to download it, and then to be able to feel the importance and self-satisfaction of being able to navigate the system themselves without having to reach out has been very helpful. We do, and that's what Aaron was speaking to. We are accredited through the Alliance of Information Referral Services, and so we have a database team, and they're called database curators for across the state of Iowa that are continually working on this day in and day out. So we're sending in updates to those agencies and programs that are in the database to continually review and update their information. If it's something that we're unable to get a response from that individual or that organization, there are 3 to 4 different steps that we take after that in order to secure the information and make sure it's up to date. So we'll just say, for example, we had an XYZ program and my database curator wasn't able to reach them by email or by mail. And so my database curator comes to me, and my benefit of being with the United Way is that we've got lots of contacts. And so if I'm unable to reach out to them or gain access to them, then I reach out to Aaron as the health officer or our president. It's that collaboration of what we do in communities to ensure that that information is still accurate. And I'm sure, as you guys know, that somebody, once they have a wrong number and they've called that number and they get a wrong number, they're going to call me back and tell me I had bad information, which is great, but they're also doing it in a positive way to share with us to get that corrected. So it's been very helpful.
Thank you very much, Aaron and Melissa, for your time today. We really appreciate it. And if you have any questions, again, Aaron and Melissa's contact information is on the screen, and we'll be sending out the slides and the recording to all the participants today. Thank you very much.
Thank you, guys.
Thank you.